I'm Bruce Shapiro, and I direct the LEN project at Kennedy Krieger. We are the second oldest MCHB-funded program on campus, which is what Bob Blum told me on Wednesday. And it was almost 47 years ago that Wilbur Cohen gave the keynote address at the opening of what was then called the John F. Kennedy Institute for the Rehabilitation of the Physically and Mentally Handicapped Child. In that speech, he spoke of a promise and a dream. The dream of a better life for people with developmental disabilities, and the promise that the government would continue to support these through these university-affiliated centers. And in fact, that promise almost didn't happen because, as is commonly the case, Public Law 88-164 did not contain funding for the training programs. They just provided for construction. And when the bill came through for the cost of the training programs, the various federal agencies that were involved, with the exception of one, went to the restroom. And the Children's Bureau stepped up and assumed the responsibility for the costs of the training. At that time, there were 5 programs. The Kennedy Krieger Institute has maintained its promise to people with neurodevelopmental related disorders. We continue to focus our efforts on the changing needs of this population. We develop novel service programs, both medical, educational, as well as social services, to address the issues of care. We undertake cutting-edge research that will let us understand, treat, or prevent these disorders and continue to train professionals. While we are very proud of our research and service programs, it is the training program that has had the greatest impact over the past half-century. Kennedy Krieger trainees have assumed leadership positions throughout the United States that support the efforts of the Maternal and Child Health Bureau. They serve children with neurodevelopmental and related disorders in a variety of settings. They train the next generation of leaders in their home disciplines and in other disciplines. They direct LEN projects, developmental and behavioral projects, and they administer federal programs. Indeed, it's hard to do something in the area of developmental disabilities and not run into people who have trained at KKI. At a very practical level, the LEN grant continues to enable the KKI to meet its training mission. More importantly, it has infused a set of values and created a culture that is reflected in our mission. We at the Kennedy Krieger Institute dedicate ourselves to helping children and adolescents with disorders of the brain and spinal cord achieve their potential and participate as fully as possible in family, school, and community life. Looking forward, the LEN projects will continue to train professionals and bring the latest knowledge to bear on the issues of people with neurodevelopmental and related disorders. These are exciting times. Meeting the challenge of the autism epidemic, applying the new genetics to the individual, utilizing technologies to enhance function, developing new models of care to reduce disparities and achieve better outcomes, and of course, and understanding the ethics of our interventions are some of the challenges that LENS will approach. The Maternal and Child Health Bureau should take pride in the accomplishments of the Kennedy Krieger and the other LEN projects. These projects have been at the forefront of change for people with neurodevelopmental disorders and their families and represent the best that government accomplishes.